Good afternoon, everyone, and thank you for joining our May Telehealth Learning Collaborative hosted by the North Country Telehealth Partnership. My name is Nancy Del Mastro. I'm the Telehealth Project Manager at Adirondack Health Institute, along with my partners at Fort Drum Regional Health Planning Organization. We're excited for this month's meeting. As usual, we'll be starting with some quick policy updates. And then we will transition over to our featured presentation from the American Heart Association, follow that up with some Q&A, and then additional updates on behalf of the partnership before wrapping up the meeting. We do have a smaller group today, so just a reminder, this will be recorded and all of the information shared will be circulated in a notes document and available on our YouTube page that will be shared after the meeting later this week. So before we get to our featured presentation, I have a brief update to share on behalf of New York State DOH. Kate Bliss was unable to join us today, but she wanted to share that New York State Medicaid has created a telehealth policy manual that largely mirrors previous comprehensive Medicaid updates that have been published. Understanding that some people are unsure whether guidance they find in Medicaid updates is current and up to date, DOH wanted to have a standalone policy manual that would help people locate current telehealth guidance for New York State Medicaid. So that being said, the New York State new telehealth policy manual was published earlier this month in May, and it does also contain the e-consult policy, which went live last month on April 1st. And DOH does plan to make updates to the policy manual as needed, and those updates will be announced in Medicaid updates. And if you don't receive Medicaid update emails, I'll be sure to include the sign up for those listservs in the notes as well. So you can make sure that those are coming to your inbox, and we will be sure to circulate any updates as well with our telehealth at ahihealth.org email address where we share this information. So I'll put the link to the new policy manual in the chat for quick reference. And again, this will also be included in the notes. And if you have any questions on anything that's in there, you can feel free to reach out to me or the telehealth inbox that New York State has as well. And just pop that in the chat now. Bear with me one moment. I do see Anna is on from OMH. Were there any mental health updates from the state that you had to share today, Anna?
No, I don't have any updates as of right now.
Thank you so much. And again, the telehealth policy manual from DOH does include links to OMH, OASAS, OPWDD, a comprehensive guidance listing from New York State for Medicaid. So if you do have any questions, I think this is a really great document, one-stop shop for everything happening telehealth in New York State. So with that, we'll get right into the presentation, and then we could circle back on additional updates after that. So Allison, I'm going to turn it over to you. We're going to be hearing from Allison Ballard-Kelly from the American Heart Association, who's going to be discussing some professional telehealth certification opportunities.
Hello,
Allison, sorry, we did lose your audio for a second, but that just came back and we can see your presentation.
Okay, wonderful. Like I said, good afternoon, and thank you, Nancy, for extending the invitation to have some time today to share with you what's happening at the Center for Telehealth here at the American Heart Association. My name is Allison Ballard-Kelly. You might know me as Allison Ballard. I'm newly married, so getting used to saying that.
Allison, I lost your audio again.
Delivery. And,
Allison,
I've been
Allison,
married.
we keep losing you.
Geez. I have a connection. I don't know why that's happening. I'm going to continue.
Yes, just continue and then I'll send you a note if it happens again.
I'm not sure. Anyway, I'm going to jump right into the presentation. Here at the American Heart Association at the Center of Telehealth, our vision statement really is to be the next leader to provide equitable, patient-centric, integrated solutions that maximize the telehealth benefits for all. Just one thing I wanted to share is we received the Helmsley Charitable Trust grant. And in welcoming that, it really is allowing us to reach the goals that we hope to set in the world of telehealth, to be the premier resource, the market leader for telehealth education, provide certification and evidence-based solutions, including quality improvement standards, as well as metrics. This will improve patient access and care in all health outcomes by ensuring that telehealth is integrated into each care delivery according to its highest quality and evidence-based standards. What is the strategy in which we're doing this? We hope to develop and deliver comprehensive part of my team are developing the certifications. So this is really the strategy that we're taking under the American Heart Association to deliver the gold standards in telehealth care delivery. This next slide really just kind of gives you a visual of different areas. I'm sure all of you are kind of aware of which we use telehealth and why it's really become an increase avenue of modality of care. So when we think of a place where preventative care, general visits, I think we saw a 35% uptick when COVID happened to use telehealth, and we kind of really needed to incorporate this. And human nature and just kind of the way we follow what we like to do is to see our practitioners in our visits. But, you know, in all wellness and corporate health, I think the future will hold that it's going to be almost beneficial or more efficient to kind of have some touch point calls via telehealth. Has also become very more efficient. Moving along is any remote patient monitoring, post-acute, skilled rehabs. You know, sometimes when the patient is either being managed inside of an acute setting, but once they go home, they need to understand what their plan of care is, and to follow that out, they might need to incorporate remote patient monitoring. Using peripherals, you know, having a software-based platform that the care team can be connected and make sure that they're adherent to their plan of care. So that's another way that the telehealth can bridge the gap to assure that they're reaching the best delivery of care that they can. And then as we've seen, there has been an elevation to what's called hospital at home. So it's really, it's a touch point. A lot of nurses have to go in and make sure that they see the patient multiple.
Allison, we did lose you again.
is, well, what is the problem the American Heart Association is trying to solve with professional certifications in telehealth? Just this past year, which is 2023, I should say, not 24. Evidence suggests that telehealth can make healthcare accessible, efficient, and particularly for those who otherwise lack access to quality of care to be in reach. We also realize that if there's physician burnout, you can incorporate telehealth in any type of care needed. So just to kind of highlight who can actually be certified and take this certification. So our certification offers this to individual professionals. It is a self-directed exam that is taken in your own home. The eligibility requirements are, as you see on this slide, we have extended it to any licensed medical professional, allied health professional, administrative personnel, and a student rising, to become a healthcare clinician. It does require in the past 12 months to have 5.25 CE education credits. And on our professional education hub, which is where we actually as well as the exam. Seems like I'm having tough technical difficulties. Next slide is what is the process of the certification? So enable to actually be eligible, as we just showed you the eligibility requirements, you need to attest that you have done that in the past 12 months. Then once you purchase the exam, you have up to a year to actually complete the exam. And then once you do complete the exam, which is done by a third party in your own home, you will then be given what's called the branded seal. It's a check mark that you can validate, and also the acronym next to your name called CPAHA. So that would be Certified Professional by the American Heart Association next to your name. Currently it is in telehealth, and then in the future we'll be coming out with more disease specific. The certification maintenance is 15 CEs within the 3 years to recertify yourself. Otherwise, you also can pay $175 to recertify. Content is outlined. It's the introduction to telehealth is 16%. So this really breaks down exactly what content is actually part of the exam. The nice thing about what we have done for all of those that engage and do pursue this is we have a very comprehensive study guide once you purchase it that you'll be given, as well as a handbook. And it kind of really digs deep into a little keep saying that I'm muted. I hope I'm not. So that's the first one we came to the marketplace with. We also last fall and end of October, we have collaborated with the Association for Treatment of Tobacco Use and Dependency. It's called ATUD. And in that collaboration, we are trying to improve tobacco treatments efforts and launch the certification to make it worldwide to prevent causes of death that are in result of cigarette smoke and tobacco use. But exciting news, which is coming around the corner, is our telehealth stroke certification. That is actually going to be launched in June. We just completed a lot of the beta testing, and we're really thrilled because we're known for stroke, get with the guidelines, stroke basic gold standards that have been followed in many organizations across the country. So we're thrilled. We've had a lot of subject matter experts and science and advocacy kind of really supporting us on bringing this to the marketplace. So very excited for this to come. Some tidbits about that, just that I could share, even though it is not in the marketplace just yet. The 6 modules that will be covered in telehealth stroke is introduction to telestroke, clearing the hurdles of telestroke, implementation strategies, the assessment of the telestroke patient, what the protocol is of that, telestroke for pre-hospital providers, quality measures and reporting. So hope, this is just a snapshot right now. Again, once you purchase the exam, you will be given a study guide, which is pretty comprehensive, gives you exactly kind of the buzzwords, some of the language that you would want to really hone in on before taking the exam. And then once you complete the exam, again, it's an automated system through a third party, and they will be giving you the badge of seal, a check mark that you can really show that you're aligned and build that credibility with the American Heart Association. So the last thing I just wanted to share with you here is you can learn a little bit more about it. This is a QR code. One thing about the American Heart Association is we have been around for 100 years. The Center for Telehealth, fortunately, with the funding that we've gotten, we are looking to expand a lot in which we are going to be bringing to the marketplace. This first year, we came out with 2 certifications, and I think that cadence will continue. And we're looking to bring it forth with more disease specific. So, we've had a lot of people, even in just my findings and bringing this to the marketplace, what is it that why would the American Heart Association want to be going into telehealth? And I think one of the takeaways that I just want everyone to know is the landscape of healthcare is going to change. We know it has, but the adoption of it is a lot to work through. So logistically, to kind of implement that across all parties is going to be a little bit a little bit of time, as it always is, to change anything. And I know that you're the audience who knows that well. But the reason why we've brought it to a professional is the ones that are behind, the consult and behind the screen. It's really important because once those that are doing the delivering of the telehealth consult and engaging those patients on this screen is the core concepts and bundle, which is what I said before. It allows you to receive the 5.25 core course requirement, as well as take the exam all in one. And we're giving $100 away as our celebration of 100 years, our centennial year. So thank you very much. I'm going to open it up for questions. I really apologize for any technical difficulties today. I'm going to stop this here, stop sharing.
Thank you so
Everyone.
much, Allison.
Yeah.
Yeah, we did have some issues throughout. Your audio was cutting in and out, so we did miss a bit. But Natasha, I'm hoping that you were able to clock exactly what was missed and maybe fill in some of those gaps.
Sure. Thank you for having us. This is very interesting. I was perusing your webpage, and you all have a robust telehealth framework.
Natasha, did you want to share anything?
Yes. Can everyone hear me okay?
Yeah. Yes, Natasha, we can hear you. Allison, I think maybe you couldn't hear her. So, but yeah, Natasha's going to chime in now.
Fantastic. I will say that I rarely use WebEx, and I normally use other platforms. So sometimes when we try a new platform, it can always be an adventure. And what I'll do is cover some competencies for each of these certifications. We hope that folks can explore our certifications, our telehealth certification was released with the spirit of trying to establish a benchmark for best practices. With telehealth having been used for a couple years, we want to ensure that there are standards across the board that could be implemented. Our certification covers a lot with ethics and HIPAA, best practices for telepresence, for providers, with patients especially. So there's definitely an emphasis on privacy. So traditionally, providers have been able to see patients in a consult room, but with telehealth, there can be a risk of maybe somebody else being in the room. And so our certification definitely goes into those details. There's an accompanying course as well with the bundle. So that course talks a lot about HIPAA and ethics. But this certification is also great for program administrators. There is a lot about licensing, credentialing, policy frameworks, quality measures and reporting. So we've heard that there are a lot of people that are interested in defining what benchmarks they should use for quality in their practices, technology, and this is evolving. So we are planning to update this certification quite soon. I'm happy to email, along with the slides, a list of our portfolio of professional certifications with the competencies outlined. It's a 12-page document, but it goes into more details about the competencies. And if this is helpful, happy to send this out.
That would be great. Thank you so much, Natasha. So for our attendees, if there are any questions, feel free to place those in the chat. And then if there are, I'll go ahead and read those to our presenters. But while we're waiting for any questions to come through, I'll just share a couple of other updates that were included in the agenda. So everyone has probably seen by now, but we are circulating opportunities for our 2024 North Country Leadership Summit Conference. That's our annual Telehealth and Population Health Conference that AHI and FDRHPO host each year. We're very excited. This year we'll be back in Lake Placid, and we're hosting on October 9th and 10th. So I'll go ahead and place the Eventbrite link in the chat. Registration is now open, which is a bit earlier than last year, but we wanted to, get ahead of things and make sure this gets on everyone's calendars. So along with registration, we do have our call for presenters open. We're accepting presentations on a whole slew of telehealth and rural population health related topics. Specific to telehealth, we're looking to highlight projects on enhancing digital inclusion, innovative telehealth solutions to address workforce challenges, identifying health policy and infrastructure implications that ensure long-term telehealth sustainability, telehealth as a model to improve access to behavioral health, etc. So you'll see, I'll also place the conference website in the chat. So you'll see the call for presenters form also available on Eventbrite actually. And we are accepting nominations for our annual Telehealth Innovator Awards. So if you have any colleagues that have been doing exceptional innovative work in telehealth throughout the region that the partnership serves, so it's the 11 County North Country region, please nominate them. We love to highlight the work in the telehealth space that is occurring each year. And that is also available on both our website and the Eventbrite page. And if you have any questions, feel free to send me an email or our AHI Summit inbox as well. We also have some tabling opportunities and sponsorship open. So take a look at everything, and we're excited to see you hopefully in October. In addition, the agenda includes some resources. So there's a new Joint Commission telehealth accreditation program that I linked and have some background in if anyone's interested in learning a bit more about that. There are a couple of telehealth bills that are currently making their way around, including the Preserving Telehealth Hospital and Ambulance Access Act, as well as the Telehealth Modernization Act. Last week, there's been a couple of news articles, so we're hopeful that we'll be seeing another 2-year extension for our Medicare telehealth policies. So all of those articles will also be linked in the notes document, and we'll be sure to keep everyone updated as we receive updates from our federal committees. And then we just have a couple of additional upcoming webinars and events. So of course, I have the information about the summit and some other webinars that are coming up from around the country, our national telehealth resource centers. But I do want to call out another webinar that the North Country Telehealth Partnership will be hosting on June 3rd. We are hosting a spotlight session on WebEx. This will be a collaboration with our RCORP program, so our Rural Communities Opioid Response Program. And this session will be approaches to tele-MOUD services in the North Country, and it will feature presentations and speakers from both Alliance for Positive Health and the Matters Network, and some of the really awesome work that is happening in the medication for opioid use disorder space. So that is included in the agenda and will be included in the notes with registration, but that will be Monday, June 3rd from 1 to 2 p.m. And we're really excited for this collaboration with RCORP and Alliance and Matters. So with that, I'll also just mention our next Learning Collaborative will be hosted on July 15th, again, 2 to 3 p.m. The registration for that session, along with our September 16th and November 18th, are all included in the notes with registration if you want to get those on your calendar ahead of time. Also in the agenda and notes, we have our interest form for speakers for any future learning collaboratives. If you're interested in chatting or presenting on the work you're doing in the telehealth space, feel free to fill that out as well. And I'm not seeing any questions for our presenters in the chat. And again, we apologize for the audio issues, but we'll ensure that the slides and some further details and information will be shared with the notes document. And then I'll also include Allison and Natasha's contact information if you had any specific questions that you wanted to reach out to them specifically about. So with that, thank you all for joining. We are ending a bit earlier, but always happy to give everyone 30 minutes back in their Monday afternoon. But thank you again to Allison and Natasha for joining, and all of you for listening in today. And we hope to see you at our next session on June 3rd, and then again for our next Learning Collaborative on July 15th. And you'll see the notes come through later this week. Thank you all and have a great rest of your day and week.